is Crystal Phend with MedPage Today for an on-the-scene preview of the American Heart Association Scientific Sessions meeting, which kicks off this weekend in Orlando. Dr. Christopher Cannon of Brigham and Women's Hospital is here via webcam to hit some of the highlights of the program. Welcome. So, Dr. Cannon, oftentimes we see some of the biggest news from the meeting coming from the late-breaking clinical trial sessions. What can we expect this year?
Well, you're quite right. There are a lot of big late-breaking trials. On the first day, on Sunday, there are a lot of antithrombotics being discussed, one of which is the ATLAS II study looking at low doses of rivaroxaban added to aspirin or aspirin clopidogrel post-ACS. We've heard already that it's a positive trial, met its primary endpoint, but we have no details, but are obviously looking forward to that. Another study right before it is looking at a different antithrombotic, a thrombin receptor antagonist, and this is in the TRACER study. It's an acute ACS study. We know it completed. We don't know much more. There was some safety issue in the related TRA2P trial in patients with prior stroke. They were taken off of the medication. So some question marks, and we're really looking forward to see what happened with that novel class of agents. There are also a couple of trials, interesting, intracoronary abciximab is going to be tried, and another comparison of abciximab and bivalirudin. And then finally, an interesting study that colleagues here in Timmy did called Elevate. They'll be presented on Wednesday, looking at doses of clopidogrel up to 300 milligrams a day to try and see if that could overcome clopidogrel resistance with or without the 2C19 reduced function polymorphism. So a really interesting batch of antithrombotic drugs and trials.
Sounds like it. I'm sure we'll hear more about what those findings might mean for clinical practice. There are also some potentially important trials with drugs that target cholesterol. What stands out there?
Definitely a lot of interesting things. We all have been waiting for, and we'll see this on Tuesday, the AIM-HIGH trial results. And this is the first of the two trials looking at niacin. We've thought niacin is helpful, but the preliminary results initially were reported as no benefit, and so that trial was stopped early for futility. We all want to see the full results, but it will call into question our current use of niacin. Another study in the HDL area is an early dose ranging of a new CETP inhibitor called evacetrapib, and so we're looking forward to that. It's a really hot class of drugs and one that has very substantial increases in HDL. And then finally, a comparison, an IVA study between the two big statins, so atorvastatin 80 milligrams as compared with rosuvastatin 40 milligrams, to see whether rosuvastatin that has a little bit greater HDL raising might have some benefit. Again, we've heard the high-level result that there was not a difference in the primary endpoint, but we're looking forward to seeing what exactly the battle of the statins pans out.
Interesting. We'll have to see if there's a victor in that round. What other trials should we keep an eye out for?
Well, there's a lot of stuff on atrial fibrillation, both novel approaches to ablation, new drugs. There's an amiodarone-like drug being tested, dose ranging, comparisons of drug versus ablation, so some interesting stuff there. We also will see the details of a large outcomes trial with dronedarone that was stopped early because of increased mortality. And so there, I think it's a drug that's out there we're using, and we do want to see those results to help guide our use of that therapy. Then finally, a very interesting study looking at the use of PCI in elective patients at hospitals without on-site cardiac surgery. So could this elective PCI be done at the community hospitals? A large randomized trial, Seaport-E, and so that will be of great interest to all of us to see exactly where one would want to have your angioplasty done.
Sounds like that could have a big impact. Thank you, Dr. Cannon. For On the Scene, I'm Crystal Phend, MedPage Today.